Hi friends, welcome to the gynecology part of how to approach the particular subject. So I'm sure you all know there are five major sections which RHS has given to us. So here the major idea of this video is to form a general template and then go about it on how to answer a question. So before that we know for 10 markers you have 5 pages, and for 5 markers you have 3 pages, and for 3 markers you have 1 page. Correct. So based on this, let us see how to fit things into place so that uh, you need not worry on the day of exam. Okay, first part. This and this forms the major questions. That is almost five questions will come from part one and part two. So we'll see how to go about it so that we have a proper clear cut idea so that we can form a general template and fit any disease to that particular thing, and have things going easier. Okay, so firstly we'll go with the malignancy part. So basically they will ask about clinical feature, examination findings, investigations and treatment. Okay, so this, especially these two sections, while attempting, make sure you also have a template for how to write for a 10 marker, including this. Okay, but since majority from RS4, these are the two sections which they are being concentrating on, I would suggest you to make a general template for these two at first. Okay, so again coming to clinical features of malignancy as such. So while writing clinical features, again divide into asymptomatic, local, regional and systemic. With regional, again mention about pressure symptoms, again divided into bladder, rectum and ureter. Again you can write about constipation here, and here you can write about the urgency, frequency and here again you can write about the hydronephrosis part. Okay, now I'll give you an example on how to fit it to any cancer. Okay, for example, there are two major cancers which the as per 10 marker is endometrial cancer and cervical cancer. Correct. Again, while writing CS cervix, again you will write one part as that asymptomatic case. Second part for local, what will you write is per vaginal bleeding. Okay, for regional, again you can fit in the same things which I have mentioned, and for systemic, again which is the common organ to get metastasis is lungs. Again write the same thing. Okay, I hope I am clear. Again for CI endometrium it goes in the same order. Got it. But again for ovarian malignancy, then this is where cases are being picked up. Okay, and again when it comes to investigations, again please classify it and then write to screen the disease, to confirm the diagnosis, to stage the disease and for follow-up. Again to screen and to follow up almost always are the same thing, that is nothing but your serum markers. Okay, but here you have to write how frequently you have to come for follow-up. Again to confirm the diagnosis, what is the gold standard thing, that is histopathological examination. To stage the disease, either we can go with CT or MRI for staging the disease, but also you know that there is something called as clinical TNM staging which also you can do. But to operate, again you need to know about this. Okay, I hope I'm easing the you know subject for you. Again, treatment, only these treatments you have in cancer. Okay, if it's a squamous cell carcinoma, it is sensitive to radiotherapy, so you give the radiotherapy. Again, I hope you know from 2B to 4A of CS cervix, which is the major things which you should do is radiotherapy. What is NART? That is neoadjuvant. Before that, you stimulate the cells so that between 2B to 4A you can aram se give chemoradiation. Okay, so that is the main thing. Okay, then again important thing which all people forget is about the prevention, and if you don't write prevention you will never get full marks. So obviously you need to talk about prevention, especially if it's a CS survey case. You have to talk about vaccination also, that is Gardasil vaccine and all those things. Again about vaccination for CS service you need to talk. Again regular follow-up, or in the nice case where there is a positive family history, okay, or this Leschner syndrome, all those things you have to mention that, and you have to advise them for for early family planning and uh, you know uh, prophylactic hysterectomy also. And again for especially for endometrial cancer you can also talk about hormonal restriction. Okay, so now you have the whole thing in mind. Again they might ask you about serum markers, they might ask you about side effects of radiotherapy. Those are some things which you should study, but here what is the main aim is that you should have a general template for that section, so that you can fit any diseases to that part. That is the major aim. Okay, so again, this thing you can write it for one page. Again, the major thing is on examination findings are not written. Again, while writing examination findings, you have to write per abdomen, per speculum, and what will given what will get in per bimanual examination, and also per vaginal examination, what will you get. So that this you can fit it in one page. This itself you can fit it in one page, and this itself again, staging is something which you need to write. Okay, staging requires one page, this one page, and this one page, and done. 5 out of 5 page. Got it? So the major idea why I am doing this is because I wanted to get an overall idea on what pages, how do you allot pages for that particular question, because these two question is almost sure, and without malignancy either you will get malignancy again in 5 marker itself. So I don't want you to waste much time, so that I am emphasizing on the fact that have general templates for a particular section, so that you can deal things accordingly. Okay, now coming to infection, I'll come to infertility part later, because not every I'll come to that part. Okay, again, infection, what are the major thing which does, again you need to be prepared for writing a 5 marker, though there are only 3 though majority times they will ask 3 marker itself. Again, 1 5 marker they can ask anytime. Okay, again, definition you might know. Then risk factor and etiopathogenesis, only if it's asked for 5 marker you can write, otherwise you can obviously leave it. And again, clinical feature, anywhere you can mention about asymptomatic stage. And again, we talk about discharge, pain. Again, one of the general things, again you can write it to general and systemic. Again, while writing systemic, you can also write local and non-local cause. Okay, or you can write local and complication, and you can mention accordingly. And also you have to talk about examination findings also as such. Again, you need to talk about discharge, what we will find in per abdomen, though per abdomen is nothing to mention over here, there is nowhere you will get. But again, in one condition you will have hepatic tenderness, that is right hypochondrium region, without tenderness, that is called as Fuchs reaction or something in specific organism. I am unable to remember the name, but you need to mention about that. Again, in per vaginal you need to talk about any tenderness. Okay, here also you need to talk about tenderness. Okay, here you need to talk about discharge itself, and also whether there are any bleeding spots. Okay. Again, here we need to club things because we have only 3 pages now. Correct. Then again, in investigations, again you can talk about to diagnose, to look for complication, and to start antibiotic only in a later stage if it's not responding. Okay. Again, you need to mention these things clearly, because you won't do culture and sensitivity for all. Correct. So that's one thing you can write also. And also, if it's an STD, you should offer investigation for partner also. That's also one important thing which you should write. Again, I'm not discussing about aims and all. Again, I've discussed everything in detail in the video. Again, this is a video where we need to where the aim is to give a general template, so I'm not discussing anything about that. Again, treatment, again same, you make sure you write the aims. Major thing is you have to mention about this and this, and people forget about these two, but these two will separately have 1 mark for sure. Okay, you need to talk about partner treatment, and also you need to give them advice about safe sexual practices and hygiene. Okay, in case of STD. Okay, now again, this board you can write it for 1 page. Again, if there is time, you can also talk about again this will take some time, so it's half a page, so 2.5 to 3 pages. Okay, so in infection, you now have a proper thing on how to mention and go about it. Again, I'm not given like ophthal, like you can also further classify it based on trichomoniasis vaginalis and strawberry cervix and perspiculum or pavit. You can do that. Again, this is for sake of convenience for my for you and me, so that we have a general template before going to the exam. Okay, now coming to the third part, this is proper core obstetrics. If you ask me, again, I'm just giving you what you can, I'm just giving an outline on how to go about it. For example, if it's a case of prolapse, you will have only 2 types of question. Okay, they will ask how do you manage prolapse in an young individual and in an old individual who is again fit for surgery and unfit for surgery. Here again, before completed family and not completed family. So this permutation combination, if you know, I'm sure you can answer any part of prolapse cases, okay, even in clinical practice also. So again, what is how do you need to go about is something which I'm giving. Again, etiology, again half page you can fill. Again, clinical feature and examination findings, aram se you can fill one page. And again, investigation and management with post-operative care. This is important. We'll eat up of the 1.5 page. So this is how you go about it. And again, for amnuria, again major thing which they ask is about cryptomenorrhea and all those things, which are very straightforward. But the major thing which they are looking is about the management and follow-up. So that is the core, and you need to invest more page on that. That is almost 1.5 page. Okay, and these two you can manage in a half page. And for menopause and puberty, local questions are asked. So answer it logically based on what the examiner is demanding for a particular question. For example, they might ask you indication of HRT in menopause. So that is straight. Okay, only you need to present 3 points and come back. Okay, again you might have therapeutic indication or again you might have absolute indication or relative indication. You need to mention that, and you need to place three things and come back. I hope I'm clear. And again, section 4, this is also one of the core gynae topic, because this is where all your proper gynae starts. Then first coming to AUP, obviously you need to write about definition. With definition, starting any paper of starting any question of AUP without definition is utter nonsense. Obviously they don't expect you to know anything. Then again you can write about the palm coin classification also. This will eat up almost one page. Again, for other things, again for management, again question specific thing and management related protocol for AAB itself. Again, here if you have seen, again for premenopausal it is different, for reproductive age female it is different, for postmenopausal it is different. So analyze things on what they're asking and write only specific management based on that. Okay, that should be sufficient. Again for fibroid, again these two things obviously should need to know in and out. Again these two will almost eat up, especially management will aram se take one page. Okay, endometriosis, again 3 theories you have, again you can fill that in one page. Again clinical feature and examination in one page, and management, that is especially the protocol you can mention. Again there is a new change in endometriosis recently in 2026. If you want, you can go and check the guidelines also. Again, urinary tract, the major thing itself is how to go about it. Okay, obviously one thing about prevention you can write. Then again, one page for clinical feature examination and one more page for investigation and management you can write. Now coming to the proper 10 marker question, again I would say this is a metabolic topic than infertility, because except congenital, most of the common cause of infertility now is metabolic, that is PCOS, okay, and ovarian things, correct. So again, while coming to this part, especially let me divide it into infertility and other metabolic disease, that is nothing but PCOS, though that also causes infertility. This is how you can go. I obviously need to write about a definition. When do you say it's a when do you say it's a infertility? Again, while writing causes, make sure you write a diagram and you can fill all the causes in one page. I will just give you an example. Okay, if it's a male factor, if they're asking, obviously you can write testicular, pre-testicular and post-testicular. Here only you can fill off the half page. Then again you classify it. You will eat up one page. Okay, then again coming to investigation also, again how will you write investigation is, first you have to write infertility treatment is a couple based treatment and not an individual treatment. So you have to write investigation for both male and female irrespective of the questions on what they have asked. That is one important thing which you need to understand. Then again management is again case specific. If they are asking anything specific which they want, then again you have to write it accordingly. Okay, that's one of the important things I would like to say. Then again metabolic, again PCOS is something which they can ask, which is almost like a sure question, I'm sure you know. But again for PCOS it has a very different narration. For example, while talking about complications of it, we talk about short term, long term and metabolic complications, if I'm not wrong, which I have already discussed in video. So I would highly recommend you to have a separate template for that itself, because it's almost a sure question where you cannot take any any chance. So I don't want you to do anything there. Okay, so that is one more thing. Then this, I hope I'm clear with this part. So see, now if you go back and check, there's nothing much to learn in gynec as such, because for everything you have a template. Ops is not like that. Obviously, we have discussed about the ops in the other video. How did ops go? Ops had a different thing for different diseases, because you need to learn separate cutoff for anemia, separate cutoff for GDM, separate cutoff for PIH. But Gynec is not like that. Gynec has an easy narration, and Gynec you can understand it easily also, provided you are concepts of in pathology, especially the reproductive system part of pathology, strong. So if you are feeling it weak, you can go and revise that part and come and see the ops video. But if you are not in a state of doing that, I would highly recommend you to form a general template for all the sections in particular thing. I agree there are some sections where you cannot form a general template. In those cases, what is the main aim is classify the sections into sub classifications, which I'll be discussing in the next ENT video. What you can do is that, for example, if one or two diseases look alike, okay, then you can club those things. For example, infection, in infection 2-3 things look alike. Again, acute infections look alike, chronic infections look alike. So club those things and form a general template is what I would say, because without general template you cannot answer the 40 marks. So what is the major problem with us is 60 marks plus 40 marks. 60 marks is something which we have predicted, but 40 marks is something which is not there in my hand or your hand until and unless we get the paper. So here the plan is to develop an approach for that 40 marks, and how do you write those questions even if you don't have any knowledge in it, okay, or with having with basic knowledge, how do you go and attempt the paper? That is the whole core idea of doing this video. So that's what I wanted to give you a general template, so that you don't miss out on this, or miss out on all these things, okay. So I hope I have made Gynec easy, and also make sure that I have also left all these procedure related things, pharmac related things, anatomy related things, physiology related things. All these things you cannot form a template. Point number one is that. And these are things which I hope you have studied before, okay. So I'm not doing anything there. That's your duty to go and study that part, okay. So that's one more thing. So have these core things in mind, and also even when we are diagnosing things, because now after RS4 question, 40% of your marks should be based on your case based thing. So even if you are stuck, you have these general things in mind, right? Okay, this is for 40 marks, this is for 40 marks, something like that. So you can rule out and come to a diagnosis saying, oh, it might be this section might not be from infertility, or this section cannot be from malignancy. If you are unable to get through that, okay, if the question is that tough, but never the questions will be tough for diagnosing itself. Okay, so that's what I wanted to say. So have a proper general template, then now go to textbooks or Maro or whatever you are referring, then add things which are specific to specific things, so that you have a proper material to revise a day before exam. Major aim for every person should be, how do you revise a day before exam than what you are doing on the day of exam. Okay, so that's it for today. I wish you the best. Thank you.